Basically hair transplant can be done by two methods, roughly two methods. First is FUT or follicular unit transplant, and second is FUE, that is follicular unit extraction. Now in case of follicular unit transplant, we take a strip of skin from back of your head, that is donor area. We take a strip and we stitch that area and we dissect the strip into multiple grafts. The advantage here is that we get a bulky grafts which has a good survival rate. But the disadvantage over here is that we get a scar also, and because that area is involves movement continuously, so the scar can stretch also, and it has been proven over a period of time that leads to scar and you can't completely shave off your head and all. Second method which is nowadays which is most commonly done is FUE or follicular unit extraction, where we extract hair individually. Now the advantage with previous method was that we used to get a bulky grafts which had a good survival rate, but nowadays we are using kind of punches we are using, those also give a good bulky grafts. Actually the quality of punches which was initially present is better now. Because of that we get good quality grafts in FUE also, and the survival of graft is good actually. So basically in FUE we individually take out the grafts and those are implanted. So this is the basic difference between the two. Nowadays we are having modification of FUE such as no root touch technique, where we don't touch the roots basically. So because of that the damage to stem cells is less. Then out of body time, like how much time the graft is staying outside the body is also very important. In our center we make sure that out of body time of the grafts is less. Third thing is kind of slits we are making. It can be done with the sapphire blades, which is nowadays called as sapphire hair transplant. That also helps in making good slits at a good density. So that can be used in FUE as well as FUT also. So these are two methods of doing it. Generally as far as I am concerned, FUE has evolved over a period of time and it is the preferred method nowadays. It involves lesser downtime and it's scarless, literally painless surgery. So that method is preferred now. The cost of hair transplant is a area of concern in lot of patients, but I tell you it depends on the kind of setup you are doing hair transplant. It depends upon the kind of expertise of the person who is doing transplant, how much exclusivity the person is giving actually, and what kind of instruments, what kind of methods are being used, and what kind of time is spent on doing hair transplant. So obviously it varies place to place and depends on all these factors. You have to choose, if you ask me, you have to choose quality over quantity in case of hair transplant. You can get n number of offers and n number of people telling you that we can do hair transplant at this cost and that cost, but I am telling you cost is not the factor over here. It is about preferring quality over quantity.